Welcome back to Wave Country. About 1 in 15 children, or an average of 2 per classroom, is exposed to domestic violence in their home. One place where children and families can get help is the Center for Women and Families. Here with us is Elizabeth Wessels-Martin, CEO of Center for Women and Families. She's here to talk about problems associated with the back-to-school transition for kids who've experienced or witnessed domestic violence. And for these kids, it's a stressful time just going back to school, even under normal circumstances. Sure. For children who experience domestic violence in the home, what does this time mean to them?
For children experiencing domestic violence, it's an extra layer of complication for them. They're coming out of the stress of COVID already. And then in a situation where there's family conflict, family violence, especially if it's happening between mom and dad, the two people who are supposed to be keeping them safe, it's extra complicated for them, worrying about what's going on at home, worrying about what's going to happen when I come home. Do I have what I need? Oftentimes we know that children who are in domestic violence homes end up being homeless. And so there's an extra added stigma to them as well. The lack of supplies, other people knowing about that. You know, oftentimes we think that children who come from domestic violence homes don't want to see the offending parent, and that's not the case at all. So again, am I going to see my mom or my dad? What's going to go on when I come home? Have I been up all night because mom and dad have been fighting?
A very confusing time for these kids.
Extremely.
What sort of impact does that have on their health? Physical and emotional?
Well, we know that if children aren't getting the right amount of sleep, that impacts them. Are they eating? Is the stress so much that they're not able to eat? Is the parent situation so stressful that maybe breakfast isn't normally being cooked for them? Maybe somebody's forgotten to give them lunch, food, or lunch money to be able to help them along the day. All of the factors that we think of for when kids are in homes where there isn't, those things are often absent for children who are in homes where there's family violence.
A lot of people involved in child welfare right now are concerned that now that everyone is back to school in person, that this is the time that teachers and other trained personnel are going to be seeing potential cases of abuse, domestic violence, things like that in the children that are coming back. What is your concern?
I have the same concern as well. There's a strong intersection between child abuse and domestic violence. We know that they often go on simultaneously in a home. And since children haven't been in school and teachers are the #1 reporting source for children who are in child abuse homes where there's child abuse or homes where there's domestic violence, that hasn't been happening. So we are prepared for those numbers to increase, not only in cases of child abuse, but also children going to school talking about what's going on between mom and dad or partners.
What are some of those red flags that teachers are going to be looking for?
They're going to be looking for a change in behavior. This isn't the same child that maybe I saw on Zoom or whatever virtual platform they use. This isn't the same child that I saw before. Changes in hygiene, falling asleep. Maybe they're agitated and all of a sudden getting in arguments or fights with other kids at school.
Acting out.
Acting out, absolutely. Acting out what they're seeing.
This could be violent.
It could be violent. We have seen an increase in violence at the center with people that we are serving because of what they've gone through, and we've seen the same thing with kids at the center. I won't be surprised to see the same thing in the schools.
Now, there was a whole long list of warning signs, red flags, and beyond just the fighting, sexually inappropriate behavior.
We know that oftentimes kids who are sexually abused will imitate that behavior. They will mimic that behavior as a way to master control of what happened to them. We oftentimes see that with victims of sexual abuse. Again, what has happened to them in the home? What have they been victims to? They may also act out as just a way of, I'm trying to master control of what's happening to me, and I'm going to imitate this.
And then there's the more common symptoms like isolation, bullying others, or being bullied, truancy, bedwetting. Past a certain age. That's also a red flag.
That is a red flag. Often children who are very stressed and who are carrying a lot of emotional pain and they don't have a way to express that either through counseling or through therapy or a safe person to talk to will act that out, and that oftentimes comes out in bedwetting at night.
There's also children could fall asleep in class.
Absolutely.
That could be just something simple where a child didn't get enough sleep at night, but it could also mean something bigger.
It needs to be looked at. If you've got a child that's falling asleep in class, please check in with them. How are things going? Are you getting enough sleep? Why are you not getting enough sleep? Children will often talk about when there's violence going on between their two caregivers, especially at night. We oftentimes think that kids are resilient and they don't hear that. That is absolutely not the truth. Kids hear every bump, every scream, and every hit.
And when going back to school, a child in that situation could be particularly vulnerable if the person who's causing the violence in the home could come to the school and take that child, right?
We have had that on a number of occasions. We have a bus stop near the center. I don't want to give the exact location, but near the center for the kids who go to the center. They are part of the homeless child population of JCPS. And we've had perpetrators show up at the bus stop to try to take that child.
What do you do in a situation like that?
Well, now what we do is we have a staff stand out there with them, and we actually have asked LMPD to be within the vicinity of that bus stop so that if a perpetrator who is not supposed to have access to that child shows up, we can quickly ask for help.
The fact that we have 2 children possibly in every classroom who's going through this is frightening. It's
very frightening. And it goes to show the community how prevalent this is, how often domestic violence is happening in homes, how often we've got family crisis, and we know that it escalated, especially during COVID.
Schools are a great safety. What can people do in the community? They should be looking out for these warning signs as well.
Absolutely. What we want people to do is to speak up, reach out. You see a child who is acting differently in any way, shape, or form, ask them, what's going on at home? Tell me a little bit about what's happening. Do you have enough to eat? Are you sleeping? How are your brothers and sisters? See how you can help. But again, don't turn your head and act like it doesn't exist.
Do people call police? Do they call you?
They can call Child Protective Services. There is the hotline. They can also call us, or they can encourage someone associated with that child to call us.
And when there's a situation like that you become aware of, you offer some residential services to get some of the people out of the home and give them a safe place to stay, but you do a lot more than that.
We do. We're out in the community. We work in the court system. We also do work in JCPS, where we have done a lot of training of staff, of teachers, of counselors, to be able to recognize the signs, to be able to have the conversations with children who are in family crisis.
Now, a lot of this requires a great deal of study and a great deal of work with patients to know exactly what to say and what to do. Every single child that comes to you is different.
That's right. That's right. And it's really important to know a little bit about that child if you can. What's going on in the home. Maybe what is their culture? What are their beliefs? Who all lives in the home? And it's very important. The most important thing is that you approach a child with compassion and understanding. And again, ask questions, not what's wrong with you, but what's going on.
Now, you have some ways you try to reach teachers during this, or reach parents during this time. What do you do?
We have done a lot of training, so we offer a lot of support groups for families. We offer trainings for families, for parents, to be able to have conversation with them about helping them understand what's going on with their child. Your child may be acting out, and this is why. They're feeling the same stress that parents feel. They're just going to show it differently.
And during COVID, so many families were under stress. What were you seeing?
Oh, well, we were seeing once things started to lift back in June of 2020, we saw a drastic increase in the number of calls. Unfortunately, the stories that we were hearing were much more severe in their injuries. Stories that we feared we would hear, we did, in terms of people being locked together, gun violence going up, drug abuse going up, alcohol abuse, people losing their jobs and losing income. Unfortunately, it was the perfect ingredients for family violence.
A lot of this has been anecdotal, having some experiences, seeing maybe a few extra cases, one group here, one group there. How long will it take before we finally have our hands around the extent of this problem?
I wish I had that answer, Dave. I think the surgence of the Delta variant and all that's going on is a grave concern to us at the center. We so hope that things do not shut down again, because that's the worst thing that can happen to these children and families. But in the meantime, while things are still open, we need to still continue to have conversation and make sure that children and families are getting resources and, again, having those conversations.
In the minute that we have left, how can people help you? You need volunteers, right?
Volunteers. We need volunteers to come volunteer at the center. There are opportunities for people to spend times with just the children. You can play with the kids. We have a beautiful child enrichment room. You can play with the kids. You can read with the kids. We encourage people to come and have parties, birthday parties, back to school parties. We're not far from Halloween. Come, bring your groups, and bring some joy to these children's lives. They don't have a whole lot. And staff do what they can, but we're always stretched like everybody else. So if people want to volunteer, and of course give, you can go to thecenteronline.org.
And even if people don't want to volunteer, and they can still participate by being part of the community, keeping their eyes on children, always asking questions.
Absolutely, absolutely. Please stay involved. Please stay curious and stay compassionate.
Elizabeth Wessels-Martin, thank you so much for being here.
Oh, thank you.
You provide such an incredible service. There's so many families and children out there who need you, and congratulations on the good work that you do.
Thank you so much.